Hello, good morning. I'm back on my lives. I'm doing a live on Facebook every morning this week. It's really important to me. I'm so passionate about scar tissue and supporting people who've had surgery and injury recovery. And there just isn't the level of knowledge out there that there needs to be in order to really get the best and optimal kind of outcomes for somebody who's been through a surgery and injury. They're not getting the advice from, when their kind of healthcare team, because it's just not really stressed enough. It's quite specialist individuals within our healthcare system who've got the really good knowledge about scars and these kind of core basics which we could be providing within the world of sort of manual therapy. People in private clinics could make a huge difference to the clients that we see who've had those hip replacements, who've had an accident on their bike when they were cycling in the lanes in the summer, who've had a little mole removal because they suspected, they were worried about it. All of these people that we're seeing in our clinics all of the time have had a C-section, who've had a hysterectomy, who've gone in for a keyhole surgery for that shoulder problem that they decided, needed surgery, or the knee problem. If we could be able to help those clients better, we're actually really going to make a big difference to the scar tissue that they have to live with for the rest of their life. Getting it right in those early stages really does set a good foundation for that skin recovery, that fascial recovery, that mobility recovery. And after all, isn't that what we're here to provide? So if you missed it on Monday, I was talking about documentation. So every day this week, I've got a different topic. I was talking about, what do we need to capture? How should we assess somebody after an injury or surgery? What things do we need to think about for our documentation for the treatment and for the client? What should they be documenting? How can documentation be used, particularly around surgery and injury, that's perhaps a little different to what you're normally doing with your clients anyway? Then yesterday I was talking about get moving, scar tissue and stiffness. Scar tissue has got less elasticity, it's stiffer, it can be contractile, so it can kind of really shorten and limit movement. So what could we do and how could we influence that to be as good as possible and keep that tissue mobile? And when should we be thinking about it? Today I'm talking about hydration and scar tissue. Tomorrow, keep it up, fluid build up after surgery and injury. And then on Friday, mix it up. So we're talking about using a varied treatment approach to people who've had a surgery or an injury. You shouldn't just have 3 techniques that you kind of bring out for every single session. There is so much that we can do within manual treatment for scars with lots of different approaches, with our hands, with cupping, with tape, with IASTM, so with massage tools. There's lots we should be doing, and we need to think about how to vary those treatments to really help stimulate ongoing improvements in scars. So today, have a drink, hydration and scar tissue. Right back from when I did my very first course in, I think it was about 1990, about looking after people after they've had their appointment with me in clinic. It was absolutely drummed into me that part of what I needed to do was advise them on how best to look after themselves after the appointment. So I talked to them about how they needed to keep an eye on their fluid build-up, a fluid intake, and make sure that they've drunk enough. And we all know, even on weeks when the weather isn't as gorgeous as it is this week, that lots of clients are walking around underhydrated, that they're not having enough fluids. And that's something that we just do as standard, and it's very much embedded in a holistic practitioner's advice to think about, is my client going to look after themselves after the appointment and outside the appointment in a way which is going to support this tissue, whatever you've been working on, working well. Because if the body's got lots of nice fluids in them, we know they're internally better hydrated. But when you've got a client who's had an injury or a surgery, there's a different kind of hydration which should be standard advice for anybody who's seeing anybody who's had an injury or surgery. It should be as embedded within the health providers, no matter what your role is, from being a massage therapist, an osteopath, a chiropractor, a physiotherapist, a lymphedema therapist, no matter what your role is, it should be just as embedded as reminding your clients to take a drink after their appointment to keep them internally fluid provided from that external source, that we should be telling them to look after and hydrate their skin or prevent moisture loss through the skin barrier while the skin is not functioning. So if I take a step back, what is it that's going on that's different then for these individuals? So when you have a trauma or an injury, the skin, which is the body's largest organ, which is hugely functional in many different ways, the skin provides obviously protection from pathogens and bacteria in the environment, protects us from the harmful rays from the sun by having melanin production in it. Once you've got a cut, a laceration, it's not able to do that. You haven't got melanin production in that immature scar tissue. You haven't got that full barrier protection. It also stops all of the moisture that we have inside our body getting lost through the skin. And while you've got moisture loss occurring, which is called transepidermal water loss or TEW, you've then got an ongoing message which can really create some kind of pain signals in some individuals, can create a lot of itching signals, that there's moisture loss occurring through that skin barrier, and therefore it is creating symptoms and leading to the body's reaction to say, create more scar tissue, we've got a lot of water loss occurring. So hydrating the tissue can improve the cosmetic result of a scar. It can help reduce redness, it can help flatten a scar, it can help with the colour of the scar and support that barrier repair which is going on. It provides what is lacking in the scar at those stages, but it also changes some of the messaging that's going on. So it can reduce the overactivity in the scar. It can reduce the overactivity which is causing pain, the overactivity which is causing itching and sensitivity, and all of these symptoms which, why wouldn't you want to support your client to live without those? Yes, your treatments might help to reduce tension on the fascia and support the body in that way. Your treatments might help to calm the nervous system around the area by being soothing and providing different stimulus on the skin level and through that fascial sensitivity and neurological response. But if you don't then add on that moisturisation, you're missing a whole chunk of what is key to what you need to provide. And if nobody else is providing it, which at the stage they're seeing you, it's unlikely they're going to get that advice from anyone else, then that information is just missing, and those people have to live with those symptoms until their skin repairs sufficiently. So you can see why I'm so passionate about this. So what could we offer? What are the options for scar care? And scar care should start the minute it's no longer a wound. So when the scabs fall off, up until that point, it's a wound, and that falls within a totally different remit. It would normally be out of the remit of most therapy practitioners, unless you work within healthcare, because wounds have a whole other considerations for infection and everything like that. So once you haven't got a wound and you're then talking about a scar, it falls really nicely within the remit of a manual therapy practitioner, so massage, osteopath, lymphedema therapist, reflexologist, a chiropractor, a fascial therapist, a holistic body worker, whatever it is that you do, even doulas and people who support postnatal recovery, you could be providing this advice, simple advice and easy to provide quick results for your clients. So the minute it doesn't have scabs, that's when the skin is most lacking in providing those functions. So that's when we need to get started with a good regime of scar care to stop that hydration loss. The best known barrier to prevent moisture loss on the skin is silicone. Silicone comes in different forms. The two forms is a gel or a sheet. I'm just going to grab something. So the company that I go to for my scar sheeting is Scarban. In UK it's Espia Health. This is some of their range. So they've got a silicone sheet for C-section, a round nipple after breast surgery, big ones for abdominoplasty or different shape surgeries. They also come in clear, so no matter what your skin tone, your skin colour, if you are somebody with darker skin, you're actually more predisposed to getting complex scarring, and with their clear plastic sheets, these are not, they will blend in with any skin tone, not just pale skin tones, but they do also come in pale skin tones if you prefer, and slightly different sort of benefits to that than the gel, which I'll talk about in a minute. This is from the same company. It's a silicone gel which has got an SPF in it. So when might you need an SPF? If somebody has a surgery which is exposed to the sun, either get a product which has an SPF in it or put an SPF on top. So silicone gel, let's say you've got a surgery on your nose, you've had, maybe something suspicious removed off, because you're worried about skin cancer, that would obviously really be affected by the sun during the day. So making sure that you've got that looked after with a SPF would be really, really important. So you could put silicone gel on that. Would you want to put a big silicone sheet on your face in the middle of the day, walking around, even if it's clear? I don't think so. But if you've got a scar somewhere on the torso, for example, and particularly if it's getting irritated by clothes, the gel will provide some kind of barrier which might change that messaging, because it kind of sits on top of the skin, so it might feel slightly different with the rubbing. But I would go towards going for a sheet, because actually that's really going to provide a little bit of kind of compression on the scar, but also it means that the scar's no longer being rubbed by movement of clothes, which for some individuals that really bothers them. So they sort of say, oh, I can't wear this and I can't wear that because I don't like how it feels on my scar. So if we go with the silicone sheeting, that provides that barrier. It's an investment. They normally work out around about £10 a week or a bit less. If you go with silicone sheeting, they last for a number of weeks, and then and you wash them on a daily basis, they become sticky again, you reapply. You can also buy other products which are disposable. I'm always thinking of landfill, so if there's something that's reusable, that's good. So silicone stops the moisture loss, so in a sense locks in moisture that's already there, and it also can provide some protection as well, and it can change the messaging if you've got kind of skin irritation, and it should be your go-to product for people who've got darker skin or at risk of hypertrophic or keloid scars because of a history of that happening in the past. Dark-skinned individuals do anyway have a higher chance of developing abnormal scar tissue because there are genetic factors involved. But there are other products that you might consider for somebody who's not got a history of bad scarring, whose scar perhaps isn't giving them lots of irritation at the minute, which should be your kind of standard, which would be to say, why don't you just start off with a cream? So the cream I really, really love is the Alhydrin. It's a medical scar cream produced by the same company who do that, silicone, and sold in the UK by Espia Health. It has got 3 properties which are good for scars, and not all creams will have all of those 3 properties. So it's a bit occlusive, which means it sits as a barrier. It's humectant, so it pulls in water from the surrounding tissues, and it provides hydration as well. So it delivers moisture, it pulls in moisture, and it stops moisture loss. And it's particularly if people are saying their scar's still quite red, they want to really get their scar to stop being so red, I find that really useful. Itching and pain, it's also really useful. It's very soothing and calming. There are there's a whole range of different creams. It can be quite worrying if people are putting a cream which has got a lot of chemicals in it, or has got a lot of perfume, has got a lot of synthetic colouring. So I have had individuals say that they're putting on Nivea, for example. For me, that wouldn't be my go-to product, and I prefer not to have anything with sodium lauryl sulfate in it. There's a medical cream called Methoderm, which is really minty, as you might expect, Methoderm, and that can be really cooling to the skin and quite nice for people who've got might be having feeling really hot around the scar, or having hot flushes. Maybe they've had a hysterectomy, or they're on some medication to go into a chemical menopause after breast cancer, in which case actually having something cooling can feel really nice. And again, that cooling can really help with the itch and sometimes the pain. So that's available in pharmacies. And then you've got oils, the world of oils. And oils come in and they provide different kind of nutrients. If you think of it as a diet, you know, we don't just want to eat one thing, we want a varied diet. And what oils come and provide to the skin, if you put on a pure oil, will be slightly different than what you get from a cream. The oil hasn't got a water content, so it doesn't deliver water, but it really helps with the fatty parts of the skin. So we've got a lipid barrier that can help repair that. There's a company called Naki who do a scar duo with an intense repair oil. It's kind of quite sticky and orange, deep coloured, and then a finer skin optimizing oil, which is really, really nice as a kind of 2-stage treatment for scars. You could send your client to a health food shop for some organic rosehip oil, really well known throughout history. It's more simple, it's got less different things in it, so if somebody's really highly allergic, that should be really, really plain. It's rosehip oil and nothing else. And the thing that I use a lot when I'm doing my treatments as well is from Somerset Bee Balm, which is actually a kind of a thick product which I use for doing massage on and around the scar, but in itself I also use it as hand cream. It's really, really good for, there's loads of things in that bee balm which is really good for scars as well. So, and in terms of affordability, this is a slightly bigger tub, but it comes in smaller tubs as well, and it's really amazing. Lip care, hand care, you know, it's good for lots of things, and it's one of my products that I really love, and to support British beekeepers as well. So that's my go-to for that. So the core message is put something on it. Put something on your scar, and if you've got a client that you know is really terrible, just sort of say, you know, just have something handy and just get moisturising every day, because putting some moisturiser on is better than putting nothing on. But there are also a range of quite specialist products that can really help if your client's got symptoms. So making sure that you know a little bit more about how to support these basics in injury recovery could make a big difference to your clients. I'll put some links in the notes after this video, and if you want to join me tomorrow, I'll be talking about keep it up, fluid build-up after surgery and injury. On Friday, I'll talk about mix it up using a varied treatment approach. Yesterday, I was talking about get moving, stiffness and scar tissue, and then on Monday, I was talking about documentation. And this is all part of the 50% off sale on understanding scars, which if you want to learn more, this is a fantastic in-depth course with interviews from experts around the world, in addition to all of the core materials where you'll learn everything that you need to think about when a client walks into your clinic with any kind of injury or surgery, including burn, in what you might want to think about in preparing a treatment program for them and supporting them with their recovery. It's had 5-star reviews, it's been taken by people around the world, and they've said how transformative it was for their practice. So sign up online using the code LIVE2024 for your 50% discount, which is on until Friday the 5th of July. Take care, everyone.